Drug decriminalization has become a lightning rod this week on Parliament Hill. The Conservative Party says the policy is not only failing, it's killing people after British Columbia asked Ottawa to roll back a legal exemption that allowed drug use in public spaces.
His extreme and radical drug policy has increased overdose deaths in British Columbia by 380%. I condemn a Prime Minister who allows open use of crack, heroin, meth, and weapons in hospital rooms that threaten nurses and on school buses next to children. When will we put an end to this wacko policy by this wacko Prime Minister?
Let's take a closer look at the numbers out west. In 2023, British Columbia saw 2,546 drug deaths. Alberta had 1,706 drug deaths from January to November of 2023. That would obviously be higher if the December number was available and factored in. And Saskatchewan saw 484 drug deaths in 2023. And you can see on the bottom of the screen there how those numbers compare as a share of the population of each province. Percentages aren't that different, even though those three provinces have very different approaches to the drug crisis. Fiona Wilson is the Deputy Chief Constable with the Vancouver Police. She's also president of the BC Association of Chiefs of Police. Fiona Wilson, thanks for joining us today.
Hi, David. Thanks for having me.
This reversal by British Columbia on the use of drugs in public spaces, does this mean that experiment has been a mistake? How would you describe it?
No, I wouldn't say it's been a mistake. I would say, like many pilot projects, there was a requirement to evaluate continually and to make tweaks and changes when we discover what does and doesn't work. And so I wouldn't say that it's been a mistake, but certainly there have been some ways or some things about the rollout of decriminalization in British Columbia that have been problematic, and I'm very pleased to see some of those issues being addressed.
So what went wrong, in your view, with the use of drugs in public spaces that Premier Eby is asking to be rolled back?
Well, David, one of the things that police have been concerned about since before the exemption request was even submitted was the matter of public consumption. Under the Controlled Drugs and Substances Act, it's actually the possession of illicit drugs that is prohibited. And therefore, when you decriminalize the possession, you also decriminalize the use. And so police flagged this as an issue way back prior to the exemption being submitted. And, unfortunately, our concerns about that have truly come to fruition here in this province.
So now the Premier has asked for it to be changed back. The federal government is considering it. My understanding is that they've gone to the province and asked for some specific information, I guess, on what the consequences of this might be, I guess, if rolling it back. What is your sense of where this is, and what could be the consequences of reverting back to the way it was done before?
Well, what we are hoping is that with these changes, our police officers will once again have the tools they need to address situations of problematic public consumption. For many, many years, our police officers have been using their discretion and following Crown's policy that basically states that Crown will not approve charges for simple possession except in exceptional circumstances. And that has been in place since 2020. So, what we're looking for really is simply for our police officers to have the legal authority to approach someone who is using in problematic circumstances and asking them to cease doing so and to leave. And really, the changes that are being contemplated will give us back those legal authorities to do that.
So this is, as you know, set off quite a large political argument in the country, right? With the advocates for decriminalization says this allows drug use and drug addiction to be treated as a health concern. And on the other side of it, we have people saying that essentially this is a radical policy that has led to an increase in overdose deaths in British Columbia. How do you view the big picture consequences of this approach that British Columbia has adopted?
One thing that we always talked about prior to decriminalization coming into effect was that it truly is just a very, very small piece of a much larger puzzle. And in and of itself, we really never believed that it was going to move the dial much in terms of the tragedy of the illicit toxic drug crisis that we found ourselves in, but that it was part of a larger grouping of resources and work that could be done in an effort to try and save lives. So some of those things include education and prevention and treatment on demand, so that when somebody who is using drugs decides that they do want help with a substance use disorder, that they can get that help. And that also includes harm reduction services as well, the whole continuum of care, right from hoping that we can educate people enough that they never start using illicit drugs, right through to the treatment on demand, so that people who are entrenched in a substance use disorder can get the help that they need. And decriminalization was always just one sort of, initiative on that continuum, for sure.
So when we see these big numbers, though, coming out of British Columbia, Deputy Chief, of 2,500 deaths last year, it's been described, it breaks down to 6 deaths a day, and there are opponents of decriminalization who blame decriminalization for the 6 deaths a day. Is that true in any way, in your view, that decriminalization is behind these deaths?
You know, when you actually look at the 15 months prior to decriminalization and the 15 months after, although there was a very slight increase in overdose deaths, it was not, a significant increase that would lead us to believe that decriminalization had actually increased overdose deaths in this province. However, it certainly hasn't reduced them. And in the meantime, some of the unintended consequences that we've seen have caused a lot of concern in our communities. Families want to know that they can go to the beach and not have somebody ingesting illicit drugs sitting next to them. And although in my experience, the vast majority of people who use drugs make every effort to do so and avoid children and youth, the reality is that when we do have those problematic circumstances, police need the tools to be able to effectively deal with it. I think that's what community expects. They don't expect that when somebody is using illicit drugs at a bus shelter and there's a bunch of kids waiting to take the bus to school, and they call police and ask police to intervene. They don't expect police to say, I'm sorry, this is not a police matter, because in the absence of any other criminality, and assuming that the person is using amounts under the 2.5 threshold, there's really no authority for us to do anything about that. And that's what really changed with decriminalization for police. It's not that suddenly you had this massive explosion of people using drugs outside. What happened, though, was when they were using drugs outside, particularly in problematic circumstances, there was no longer anything police could do about it unless they were in an exception to the exemption or there was other criminality going on.
Right. So no matter how well-intentioned this policy was to help people with substance issues, this was the unintended consequence that you now find yourself with. This is why the reverse course has been requested on at least this aspect of the policy, but writ large, decriminalization will remain, right? So I wonder, because some of the argument is that if you get rid of this policy, deaths could go down. I mean, is that believable when we look at other provinces like Alberta and Saskatchewan, where the death rates are also high and growing, and they do not have a decriminalization thing? I mean, would eliminating it, decriminalization, affect the death rate whatsoever, or is it just there's fentanyl in the drug supply?
What we're dealing with 100%, you nailed it, David, is that we have an illicit toxic drug crisis in our country. And, it's that supply that is killing people. It's not that they're using too much, for example, or anything like that. It's that the actual supply of illicit drugs is toxic and it's deadly. And as you mentioned, we have an extraordinary number of deaths on average a day, between 6 and 7 in this province alone. So taking away decriminalization or even adding in decriminalization at the end of the day is not impacting that drug supply. It's not changing the toxicity of that drug supply. And frankly, we know that that's what people are dying from because we have coroner data that demonstrates that.
So just as a final point, Deputy Chief, so the solution the interdiction of fentanyl, I mean, the US is struggling with this, Canada is struggling with this, everybody is struggling with this. That seems to be the first step that needs to be solved before these larger issues can be dealt with. Am I understanding that properly? The policy mix isn't the problem, it's what's in the supply, and until that's solved, this problem won't go away.
Absolutely, and that's where we focus our enforcement efforts for the most part. The individuals and the groups that are causing the most harm in our communities, and those are the people who are producing, trafficking, importing, exporting illicit drugs, such as fentanyl, cocaine, and methamphetamines.
Fiona Wilson, the Deputy Chief Constable with the Vancouver Police and the President of the BC Association of Chiefs of Police, I want to thank you for your insight and your time today. Thank you for joining us.
My pleasure.